Ciao a tutti, benvenuti al mio canale Os Made Easy, un canale di studio, ripasso e riflessione per studenti socio-sanitario. Hi to you all, welcome back to my channel Os Made Easy. In today's video, I'm going to talk about an interesting topic known as the oral hygiene or Igiene del Cavo Orale. So to begin with the oral hygiene, I'm going to talk about some of the materials necessary for performing the oral hygiene. What are some of the things we should know and the various categories of the oral hygiene? We have three main categories of the oral hygiene. One, we have oral hygiene of the autosufficient person, and we have oral hygiene for non-autosufficient, and we have oral hygiene for the person that wear the dental prosthesis, that's the protesi dentaria in Italiano. They do not have the natural teeth, so they wear the artificial one. So to begin with, to perform the oral hygiene in a person that is a collaborante or autosufficiente, what are some of the things you should know? First of all, you need to prepare your materials, i materiali necessari. So let us see some of the materials. So in performing the oral hygiene for a person who is collaborante means the person is able to clean their teeth alone. They are able to do certain things. You need to help the person by providing the materials and also guiding the person to do the oral hygiene. First of all, you will need your asciugamano, that is the towel, asciugamano, il viso. So the asciugamano, like we have the viso, we have the bidet, and we have the tello. So the viso, that's what you use, the asciugamano. We also have our dentifricio and our spazzolino. We have our bicchiere and we have our colutorio. So in performing oral hygiene in a person who is able to do it alone, the only thing you need to do is to provide the necessary materials. Also, if the person is on bed, you need to put the person in a sitting position. Then you provide the tello. This is the tello. When we say the tello, it is a sheet made with part cotton and the other part is plastic. So this is what we call the tello. We have many types of tello and also many sizes and many colors. So this is what we call the tello, parte cotone, parte impermeabile. So this is what we call the tello. If the person is sitting on bed, as I'm sitting right now, you are going to cover the tello around the neck to be able to save the person's dress. You're not going to wet the person and also the bed. So the tello will be placed around the person's neck. So you will have to use the bacinella or arcella. So I will use this as an example as the arcella. So the cotton is being placed around the person's neck in this way, and you have your arcella here. So you are helping the person to do the oral hygiene. You have provided the brush or the spazzolino with the dentifricio. So the person is going to brush the teeth and you provide the arcella. After that, they have to spit inside the arcella, and you have this one that is going to protect the person from wetting, and also you have your asciugamano. So after you have finished all these procedures, you then explain to the person how the person is going to do what? Do the oral hygiene. So let me go back again. Perform the oral hygiene in a paziente collaborante. 1. Materiali: asciugamano, untellino, arcella, spazzolino, dentifricio, colutorio. These are the materials you need for a person who is collaborante, so the person will do the oral hygiene themselves. In certain cases, you need to take the person to the bathroom. You need to take the person to the bathroom so that you provide a chair, or if the person is the wheelchair, it's the same procedure. You then position the person in front of the sink, then you provide the materials for the person to brush their teeth. That is Igiene, Cavo, Orale in paziente collaborante. Let's come to the paziente non collaborante. a patient who cannot do anything at all or non-autosufficient, what are some of the materials you need, and also what are the procedures? I have listed here some materials that we will need. First of all, we will need our guanti monouso. That is the disposable gloves. Guanti monouso. Guanti monouso. Also, we have our garza. That's the gauze, the cotton gauze. Excuse me. That is our cotton gauze. This is the cotton gauze. This is our cotton gauze. That is the garza. Garza di cotone. Either sterilized or non-sterilized. So you have our, we also have our abasalengua. That is the tongue depressor. Abasalengua, the tongue depressor. We also have our colutorio. That is the mouthwash. Colutorio, mouthwash, colutorio. We also have un bicchiere. Un bicchiere, you need to have a glass. After that, you pour the water in a glass and you hand it over to the person. If the person is collaborante, you hand it over to the person to wash their mouth. But if the person is not collaborante or non-autosufficient, you are going to pour inside the colutorio. That is why you need bicchiere. So, un bicchiere, bacinella. I'll use this as an example as my bacinella. Something you place under whilst performing the oral hygiene. We also have the asciugamano. I have already shown the asciugamano. That is the towel, the face towel. We have our glicerina or lip balm or any other prodotto per la labbra. Lip balm or glicerina. This is the Vaselina bianca, glicerina, glycerin or the Vaseline. We also have our tello protettivo or tello protezione. This is the tello. I have already shown it. We have our scovolino. The scovolino is a brush with a soft brush. This is the scovolino. It's a soft brush. This is what we call the scovolino. We also have spazzolino morbido. If you don't have the scovolino, you can use the spazzolino morbido, not a hard one. So these are the materials you need to perform oral hygiene in paziente non collaborante. As I've already said, non collaborante, non autosufficiente. They are the patient or people that can't do anything at all. They are dependent. They depend solely on the us. So let me go over again the materials. Performing oral hygiene in paziente non collaborante o non autosufficiente. Quali sono le materiali necessari? 1. Guanti monouso, garza, abbasalengua, bacinella, colutorio, un bicchiere, bastoncino, the one I already shown. We also have the asciugamano, glicerina, or qualsiasi prodotto per la labbra. We have the tello protezione, scovolino or spazzolino morbido. So let's move on to the procedure. After you have organized your materials on your carrello, you then move to the patient. What are the first things to do? You greet, you present yourself, then you inform the patient on what you are going to do. After that, you have to put on your gloves. Then you put the patient in a sitting position. If the person, because of certain pathologies, the person is not able to sit, you put a person in a lateral position. That's the sideways. So to begin with, you have already informed the person. You have greeted, you have represented yourself, you have put on your gloves, you have positioned the patient. You then move on to perform the activities. First of all, you need to place your telino protettivo or telino protezione. You need to place the telino around the neck of the patient whilst the patient is sitting. If possible, we have a tavolino per il letto, but if it is not necessary, you don't have to use it. Since you have your telino and your bacinella, it will be easy for you to do your work. So after you place your telino, you then prepare your colutorio. You prepare your colutorio, preparazione del colutorio nel bicchiere. Then This is your abasalengua or the tongue depressor. So with your tongue depressor, you are going to wrap the gauze, which is the garza. You are going to wrap the gauze around the abasalengua. Then you will infuse it into the colutorio. Then with another abasalengua, you will raise or you open the mouth with another abasalengua. You are not going to perform it with your hand. You can't perform oral hygiene with your fingers or your hand. You can't open the mouth with your hand. All you need to do is to use the abasalengua to that's the tongue depressor, to press the tongue downwards and also to be open the mouth. Then you will insert the abasalengua wrapped with the gauze that you have dipped it into the colutorio, that is the mouthwash. You then start from in fondo, inside. Clean the inside, bring it outside. You clean the gums and also inside the cheek before you do the outside part of the mouth. After you are done, you throw away the gauze. If you clean inside and the gauze is dirty and you think you can't use it anymore, you must change the gauze and wrap another gauze. So you change it when necessary. You don't use the same gauze to perform all the procedures when it is dirty. You change it frequently when necessary. So after you have finished, you then put another bicchiere di acqua per risciacquare la bocca. To wash the mouth or to rinse the mouth with water, that one is only done with patient who can, after that, who can spit out the water. If you are doing it with a patient who can't spit out the water, there is no need to give the person un bicchiere di acqua per sciacquare. What you need to do is to dip another gauze in the colutorio and use it to rinse the mouth. What is the use of the glicerina? Those non-autosufficiente paciente, they always come out with dry lips. So after you have finished performing the oral hygiene, you need to wet the mouth with water, clean it or dry it, and then you apply a little bit of glycerin, as I have applied a lip balm on my lips, to be able to make it moisturize and prevent it from maybe cracking or making sores. Also, when performing the oral hygiene in paciente non-autosufficiente, you don't need to use your hand to open the mouth. You don't need to press or use the basalengua with gauze. You don't need to do it too hard. If not, it will cause micro lesions and this lesione, micro lesione, that is going to create little sores inside the mouth, and it is going to take long time to heal because the person is old and the immune system cannot fight against most infections. So this is the procedure in paciente non autosufficiente. Let me go over again. Paciente autosufficiente. What are the materials you need? 1. Asciugamano, dentifricio, spazzolino, untellino. Also, you need your bicchiere di acqua and colutorio. Paciente non autosufficiente. As for that one, the things are many, so I can't memorize, so I need to look on my list. Paciente non autosufficiente. We have our guanti monouso, garza, bastoncino or abasalengua, colutorio, un bicchiere, asciugamano, glicerina, telino protettivo, scovolino or spazzolino morbido. These are the things you need to perform oral hygiene in paciente collaborante e non collaborante. Now, the last part, let us see the patients who wear the dental prosthesis. So, as Italian man will say that la bocca insieme agli occhi sono il nostro biglietto di vista. So, the mouth together with our eyes, they are our business card. So, if you meet somebody, the person tends to look into your eyes and also your smile. So probably if you have a clean teeth, you will not be shy or you will not be embarrassed to show it. But if they are dirty, you know how embarrassed it will be. The same thing happens to the patients who wear the prosthesis. The prosthesis, that's the prosthesis della dentaria. So sometimes, because the teeth is not their own, it's not natural, they might have discomfort, they might feel pain, they'll be shy to talk, they can't eat, they can't chew, because some of them, they feel uncomfortable and it's painful. But we need to take care of those prosthesis dentaria. We need to take care of it. So with that one, the procedures are the same thing, the materials are also the same thing. What you need to do is, number one, to inform the patient about the procedure. You greet in any hygienic procedure, you greet, you present yourself, you inform the patient, then you prepare the material. The materials are the same thing. If the patient is collaborante, you then provide the materials, the spazzolino, dentifricio, un bicchiere di acqua, collutorio, telino, asciugamano. You provide it, then you explain to the person how to go about the procedure. The person will clean their teeth, they will dry their teeth very well, then also you apply a little bit of the lip balm or the glycerina. Two, if you are doing it in a paciente non collaborante but have the prosthesis, that one too, you need to take the prosthesis out. You are going to remove them with the gauze. With the gauze, you are going to remove the teeth out. Then with your abasalengua, which is this one, or your scovolino, you are going to dip it into the bicchiere di collutorio. Then you will start cleaning the mouth, starting from inside, partire in fondo, in avanti. So you start from inside and comes outside, cleaning the tongue, the cheek, and also the gums, under tongue, and everything. Also, after that, you need to wet the lips, then you pat dry, then you add a little bit of glycerin. Then with the prosthesis inside your hand, you are going to wash with a toothpaste and also a soft brush. You are going to wash the teeth, that is the prosthesis. You are going to wash it very well, clean it very well, rinse it very well, and after that, you place it back into the teeth of the patient. If the person is collaborante, they don't need to take it out, they just clean it with the toothpaste and also the brush. If the person is not collaborante or non-autosufficiente, that is where you are going to take it out with the gauze, clean the mouth, then after that you will have to clean the prosthesis and insert it back. So this is what I will say about the Igiene del Cavo Orale, that is the oral hygiene. Very interesting. So if you have any questions about the Igiene del Cavo Orale, or if there is anything you find it difficult to understand, if there is something I didn't say it well, or maybe I forgot to mention something and you want clarification, feel free to comment in the comment section. Let me know if you like the video. Please share and like my video to other people, our fellow Ghanaians, Nigerians, and Congolese, all those people who are doing the Corso social sanitary, that's the OS. Let them have my video, that it will be useful to them during the exams and also in the class test. Thank you all for joining me. I love you all. Ciao ciao e alla prossima.